Hello everyone, my name is Dr. Ferox and I was asked on the blog whether I've got any miracle recovery happy ending stories from vet medicine that I can share. And as it happens I do. I've got two of them. Both of them were dogs, both of them had cancer, both of them ended up with a happy ending when maybe they shouldn't have, but one of them did everything right and one of them did everything wrong. The first case was an old beagle. Now he didn't even have an appointment. He was presented as a, while you're here, can you also check this other thing on the other dog that wasn't booked in sort of scenario. Which is exactly what you want on a busy Saturday morning when you're already booked out from open till close. But I had a look anyway. The owners were expecting it to just be a lipoma. But this lump, which was positioned about here, was in no way a lipoma. I did a fine needle aspirate, which is a minor procedure where you take a tiny little needle and you stick it in the lump to get a few dozen cells that you then look at under the microscope. Now, a fine needle aspirate doesn't always tell you exactly what a lump is. It's only a tiny, tiny sample. But it usually tells you whether it's something that's really very scary or something that's really very benign. So you get an idea of how much you should worry. This fine needle aspirate produced only blood and a couple of super weird cells that I had never seen before. So I was suitably worried. The owners were not. I told the boss about it because I did want some advice before taking this dog to surgery, being that it was neck surgery and there's a couple of very important structures that run up and down the neck. And he said not to worry, that it was probably just an intramuscular hemangiosarcoma. You go in, you cut it out, you cauterize everything until it's not bleeding, you close it up and on you go. So I thought, great, I can do that. Haven't done surgery in that position before, but I can do that. So of course I go in surgically and I find the lump, and it is not an intramuscular hemangiosarcoma at all. It's a round encapsulated thing with big thumping blood vessels connecting it to the jugular vein, and it looks glandular. And that's a horrific thing to have to try to cut out, because if it's glandular in that position, it's probably thyroid, which means you're at risk of not only doing something nasty to the jugular vein, which I'm not skilled enough to fix, or you end up taking out the parathyroid hormones. And if you take out the glands that produce the parathyroid hormones, the dog will die from various calcium imbalances. But I was already in there, and so I did my best to cut out this thing that I was quite sure was a nasty, nasty cancer. And I was very worried about it. Usually when you cut out a cancer, you're not just cutting out the lump, you're trying to cut out some healthy tissue around the lump, like a yolk in the middle of an egg, so that you have this nice margin which has definitely no cancer tissue in it, so that you've removed the whole thing and possibly cured the patient. But when it's that closely associated to a jugular, you just can't do it. But I did my best anyway. And the lump goes off for analysis and it comes back as a thyroid adenocarcinoma. And that's probably not very good. In fact, they have a fairly short survival time most of the time. I wanted to test the dog in the following couple of weeks and months to find out whether its T4 levels were okay and whether its calcium levels were okay and whether I'd accidentally condemned this dog by taking out parathyroid hormone glands. And it just vanished. I didn't see the dog. They didn't answer the phone. They didn't come back for their recheck appointments. It was like the dog just vanished off the face of the earth. Until about 3 months after its expected survival time, where it walks in because it's got a rash. Perfectly fine. No problems, no swelling. Now that dog got a miracle, and I don't begrudge the dog for getting its happy ending. I just don't know if its owners understand just how lucky they actually got. On the other hand, my other miracle case, her owners know exactly how lucky she got. Shiloh was an elderly Cocker Spaniel, And she's a very sweet little thing, but she had very unfortunate skin. And in this case, she had an eyelid lump that we were going to remove because it was rubbing on her eyeball and driving her nuts. And she also had this weird skin lesion thing on her cheek that we couldn't figure out what it was. So since we were going to do surgery anyway for the eyelid lump, I said, well, let's cut out this skin lesion and either it's off and it'll all get better, or at least we can send it off, find out exactly what it is at histopath, and then treat it appropriately. Only when I sent it off to histopath, it came back not as any sort of skin rash or immune-mediated condition or infection. It came back as cutaneous lymphoma. Now, lymphoma is a type of cancer that is very, very bad. And one of the things it does is that once it exists, it's considered to be everywhere in the body because they're white blood cells that have gone cancerous, and those white blood cells naturally migrate. Not only that, but on the sample that I'd cut out, there were already cancer cells at the edge of that tissue. So I did not have clean margins by any stretch of the imagination, and realistically had probably left lots and lots of cancer still in the dog. Now, Shiloh had a very good owner who had a lot of connections and then went off to see various cancer specialists and imaging specialists looking for the rest of the cancer, to say which lymph nodes is it in, what are the organs that are affected, where is it, what's the chemo protocol, do we do radiotherapy, what do we do, we're going to fix the dog. So she goes to all these specialists and they just end up doing their tests and twiddling their thumbs and going, we can't actually find the cancer. Which on the one hand is great, because if it's not there, it's not there. But we all knew it absolutely should be there, and it probably is there somewhere. So we spent the last couple of months just waiting for the cancer to come back that we can't find, that by all means probably should have killed this dog months ago, and just hasn't done it. Now, I don't have a little box of miracles that I can just dish out to people that I think deserve it. And it's probably a good thing that I don't. But if I did have a little box of miracles, I would have given one to her. But in vet medicine, and human medicine as well, I suppose, you just take what you can get. And if that's a miracle, I'm not going to argue with it. Thank you for listening. My name is Dr. Ferox. This cat is Trash Bag. And I'll catch you next time.